Hey everyone, when I was waking up this morning, about 4 or 5 o'clock in the morning, I started thinking, I haven't been doing very much vacuum cupping lately. And I think the reason for that is because I've been doing more myofascial release with harder objects. And I think the thing is, when you do the vacuum cupping, it loosens up the outer layers of fascia. If you don't know what fascia is, it's like this webbing that covers your entire body. You have the individual muscles, but then you have this layer of fascia that winds through everything. And when that stuff gets tight and restricted, then it causes pain. So I bought this vacuum cupping set earlier in the year. I'm thinking probably April or May, around there. And if you haven't seen any of my cupping videos, basically the way this works is you put it on this little gun like this, and you just find a tight area that you want to work on, and you stick the cup on there like that. And then you leave it on there for 5-10 minutes or so. And what that does is it kind of pulls like stagnant blood out of the muscle, and it kind of helps the muscle to relax, and it helps to soften it up so that you get better movement out of it. Now, this cupping set that I have, it has mostly this size cups. These are 2-inch cups, and then it has a few of these smaller ones. Those are almost a little bit too small. But I'm starting to think that I actually need some bigger cups than this now. I've been using these for a while, and I feel like I need some that are a little bit bigger in diameter for some of the areas I want to work on. Now, this also comes with a hose like that, so you can reach like on your back and stuff like this. Thing is, when you use this hose, the suction isn't quite as good, the vacuum isn't quite as good, so I prefer just to use it directly on the gun like that when I can. So what I was saying though is, I've done that vacuum cupping probably for 7 or 8 months now, and I kind of feel like a lot of my outer layers of muscle and fascia are getting pretty soft, and so I feel like I need to get deeper into the muscle. So I've been using things like this lacrosse ball, and I use this old rake handle a lot, and just dig that into the muscles in my arms, my legs, using on my chest, my pec minor, stuff like that. And even, this is just an old shower scrubber thing, and I use this, the handle of this, sometimes to dig into my arms or my legs. I mean, when you're doing self-myofascial release, you can use a lot of different things, just stuff laying around the house. You want to get as deep into the muscle as you can tolerate, I think. I don't use foam rollers because they're too soft and they just don't get in there deep enough. I'd prefer to use something hard where I can get in deeper in there, trying to just break up all those tight muscle fibers. Of course, I've been doing that for about a year now, so I've gradually worked up to this stuff. If you're not familiar with fascia, I really recommend that you read up on it and learn about it, because I think it's a big part of chronic pain, in my case anyway. And I did a video on upper back muscles a few days ago, and it showing that there's just layers and layers of muscle on top of each other, and those layers of muscle have to slide across each other. So I think in my case, it took me so many years to get diagnosed with Thoracic Outlet Syndrome, and those muscles were in spasms for so many years that they just got all stuck together like that, and that's a big part of my problem. And so I work on the entire body. Almost anybody that teaches like posture correction and things like that and good movement will tell you that everything is connected. I mean, a tight ankle can affect your hip, and a tight hip can affect your shoulder, and the shoulder affects the neck. So You want to work on the entire body, and that's the approach that I'm taking. So I guess that's all until next time. Thanks for watching, you guys.